1 year ago, UW Health hosted a discussion about a new form of the coronavirus that was starting to spread around the world.
And here we are, a year later, around 420,000 Americans have died from it, including nearly 6,000 right here in Wisconsin.
On Wednesday, those same panelists are joining together to reflect on the last year and discuss the future of the disease. And we are joined by two of them this afternoon, Dr. Nasia Safdar and Ajay Sethi. Thank you both so much for joining us today.
Thank you.
Thank you.
Dr. Safdar, let's start with you. So never, and I think in anybody's wildest dreams, did we think we'd be here a year later. How has this been for you?
Well, I think that, this is probably the toughest year many people have experienced in their lifetimes. It was a pandemic, and it was a serious pandemic. I think the single best piece of news has been that there are several effective vaccines available, and as long as we can get over the challenges of getting them out there in the public and into the arms of people, I think 2021 will be a better year than 2020 was.
Well, we certainly hope so. Dr. Sethi, take us back to that meeting a year ago, and you put yourself in that room and think about, all the things you didn't know at that point in time. You never could have foreseen a year like this. What were some of the discussions you folks were having at that time that you can remember?
Yeah, the virus we knew was spread through respiratory routes of transmission. And so we, have a lot of experience working with those. What was really unknown was just how infectious this virus was and sort of how many people would become ill and how many people may go on to die. And obviously a year later, we see just, how terrible this virus really is.
Dr. Safdar, what do you think 2021 is going to hold for all of us? Everybody was hoping that, 2021 would be a better year for everybody, but still the rollout of the vaccine has been very slow. So should we be looking forward to the end of 2021?
Ideally, we'd like to see some momentum in the vaccine distribution and administration plan. I think that it will be very difficult for mankind to go through another year the way that we just had. And I'm thinking not just of people that are in the healthcare professions, but primarily I'm thinking of children. The impact of COVID on school children is going to be felt for years to come, and we don't want any extra days to add to that if we can help it.
Dr. Sethi, let's talk about this gathering you're going to have to kind of reflect on the year and look ahead. That's on Wednesday night, a lot of the same people coming together. What's the biggest thing? You guys prepare so much for infectious diseases and these sorts of things, but you never really know what you're going to get. What's the biggest thing you think you've learned over this last year?
The fact that this virus is so infectious before people develop symptoms, I think has really driven a lot of the spread across the country. Once when people get symptoms, we tend to want to stay at home and not go to work. But when we're unknowingly spreading this virus around, we can see what happens. And I think that's probably one of the biggest things I've learned. I think we've all learned, as well as maybe just understanding how to communicate this information to the public so they can do the right thing and take the proper precautions. And that's also been rocky at times.
Well, I know it has been an incredible year for both of you. You're always so incredibly busy, and we still got a lot of work and a long road ahead. So thank you both for your time tonight. Really appreciate it.
Thank you.